What is your name and tell me about yourself? My name is Amandeep Kaur and I'm doing Masters in Nursing from University of Wollongong. I did my Bachelor of Nursing from Baba Free University, India. And why have you chosen nursing as a career? I choose nursing as a career because I love learning new things and I wanted to do something new in my life that is challenging, interesting, and makes a difference in people's life. In the healthcare profession, do you deal with many aspects of patient care and their families, and helping through what is often a difficult time for them is extremely satisfying for me. And mainly my mother is also a nurse, so she inspired me a lot to choose this profession, because every time I see satisfaction on his face by helping people. I knew the time when I was very young that I remember that nursing is a profession that I wanted to do in my life. So what are the qualities and skills do you have that will enable you to completely practice in healthcare environment? So there are many qualities that we needed in healthcare environment. Firstly is the communication, as it is a therapeutic tool to provide and maintain the interpersonal relationship with the client. So so that they can ventilate their feelings. And nextly is the teamwork, as we have to do work in the peer groups so that we can come to know at the end about the patient outcomes. And apart from this, the confidence is also essential, as we can't do anything, even it is a small thing, without confidence and willingness of ourselves. So it is essential that you should boost up your confidence by learning new things. And the other qualities that we have to be in this profession is time management, because we have to divide our time into in different tasks so that we can complete our job at the end of the day. And moreover, the other qualities are stress management, willingness to do or desire to do something, respectfulness, empathy, physical stamina, so that we can perform our job. So next question is, can you describe a time when you work collaboratively in diverse team to achieve an outcome? Well, teamwork is imperative and associated with a better patient outcome. I remember at my last working place where I was working a nursing assistant. The aged care sector has been now also facing many challenges due to COVID-19. But the care of older people cannot be halted due to this problem. This is the time to perform and show the teamwork to maintain the organization standards and policies of care. During the last few weeks, many many carer they resigned from their job due to this COVID-19. And rest of the staff, they have to work in collaborate manner to achieve our goals. During the shift, I remember that at that time we have only 5 staff on the 2 wings, and we have a lot of residents to take care of, and some of them they need a double assistance as well while performing care. So what we did at that time, we discussed with our RN about this issue, and divided the group of people into two groups, and one of the rest of the carer, she helps us on both sides, so that the balance can be maintained. So we divided our responsibilities in a group, so that to reduce the burden of work on a single person, we gave hand to each other in a difficult situation. And finish our jobs on the time and deliver appropriate and preferred care to the residents. This is how I performed a teamwork to get a patient outcome. This position requires you to have a high level of written and verbal skills. Tell us about a time you cared and worked for someone who was not able to understand you them. What was the situation and what was the outcome? Yes, I have strong communication skills and written skills as well, because definitely I cleared my English language test while coming to Australia, and English is not my first language. So, in the healthcare profession, nurses and patient communication generally build up due to misunderstanding and lack of understanding in the communication, which is from the both side. It's not from the single side. So I remember the time when I was working in last aged care facility. One of the resident, she was like have a hearing problem as well and speech problem as well. So she was trying to telling me something, and at the same time some of the residents, they are watching television outside in the lounge room with a very high volume. So because they have a hearing problem as well. So when I was making a communication with my residents, she was I got little bit that she was telling me about his pain and shortness of breath while performing some tasks, but I was not pretty sure because there is a disturbance coming out from the lounge room. So what I did, I just asked my resident to wait for 5 minutes so that I can fix that noise first, because that is the communication barrier between us. So I go outside and put that like loud volume in the small speakers and put those speakers next to the resident so that they can hear that one properly, and come back to my residence, and then I discuss whole thing, what was his problem and situation. Then she told that when she was performing anything by her own, she is feeling shortness of breath and pain in her back. So I informed that one to the RN, and this is how the whole situation I tackle to maintain the good communication skill. When do you have any question regarding your job? Yes, well, when can I expect to hear from your side following this interview? Well, within next 2 days, we will make a selection criteria who is going to join this aged care facility. So we will give you response within next 2 days. Thank you.